14 weeks pregnancy. Arriving at the 14th week of pregnancy, the fetus is already fully formed, but it is still very small. At this stage, it can measure around 8.7 centimeters or 3.425 inches, weigh around 93 grams, being equivalent to the size of a nectarine. Now it's time to gain weight and grow at an accelerated pace, becoming more and more like the little baby you will hold in your arms every week after birth. At this stage, the umbilical cord is already well developed and is responsible for nourishing and taking oxygen, ensuring that the baby develops, grows, and gains weight quickly. Normally, it is a good phase of pregnancy because the baby does not stop growing and the mother starts to feel more and more like a mother, visualizing every little part of her little one and seeing her belly grow. The hair appeared in the previous weeks and now he has a thin layer of hair, forming the eyebrows and a little down along the entire length of the little body. Your sexual organs are well defined and it is now possible to check whether it is a boy or a girl through an ultrasound. Speaking of which, the 14th week of pregnancy is the limit for performing the first trimester morphological examination. Mom's silhouette begins to change and the waist disappears with the rounding of the belly. It is important to opt for comfortable clothes, looser blouses, and less tight pants. It is very likely that jeans will start to stay in the corner in the wardrobe, as they squeeze the belly. If you like to wear jeans, there are some options in this fabric that are appropriate for pregnant women. How is mommy feeling? At 14 weeks pregnant, your silhouette begins to change and your waistline disappears due to the rounding of your belly, which is becoming more and more evident. If she didn't provide a more comfortable bra and panties, maybe now is the time, as any tight garment is not a good thing at this stage. Opt for comfortable clothes, looser blouses, and less tight pants. Your symptoms at 14 weeks pregnant, changes in your body. The physical changes in women are now much more noticeable, as the belly continues to grow with the baby's development, and the silhouette becomes rounder and the belly can begin to be noticed. The breasts also increase in volume as the pregnancy progresses, due to the development of the mammary glands and the beginning of the production of colostrum, which can leak and soil the bra with a yellow liquid. A woman may experience pelvic pain, called round ligament pain, which can happen on one or both sides of her abdomen when a woman changes position too quickly, when sitting or lying down, or when she coughs or sneezes. This pain is caused by the stretching and narrowing of the ligaments that support the belly, due to the growth of the uterus, being a normal condition of pregnancy. Medical follow-up. This is the week of the second prenatal visit, which can also be done until the end of the 16th week, and it is important to take the results of the ultrasound and other tests requested by the doctor in the first prenatal visit, so that the obstetrician can assess how is the development of the baby and the health of the woman. Visits should be scheduled once a month until the last 2 months of pregnancy. These regular visits give you the perfect opportunity to ask questions and express your concerns. It is very important to go to the doctor and monitor the baby's growth, as well as monitor the woman's symptoms. 14th week exams. The 14th week of pregnancy is the limit period for performing the nuchal translucency test, which is so important during prenatal care. At this stage, the doctor must request a new blood count so that the woman can take the results with her at the next appointment. In addition, if the woman is over 35 years old or has a history of genetic diseases in the family, the doctor may also indicate amniocentesis, which can be done between the 15th and 18th week of pregnancy. Symptoms and care. In the 14th week of pregnancy, some precautions are important to help alleviate the discomfort of pelvic pain, such as doing light stretches and gentle movements, approved by the doctor. However, if the pain does not improve, or if you have a fever, you should contact your doctor immediately. In addition, so that the woman has more strength and energy to support the additional work that pregnancy requires from the body, the obstetrician may indicate the practice of some regular physical activity, such as swimming, walking, yoga, Pilates, or maintaining the physical activity that I already practiced before pregnancy, but in a light and moderate way, always accompanied by a physical educator. Pregnancy care tips. For you who use hair dyes and chemicals, it's good to talk to your obstetrician and see what is recommended and not during this period. It's better to sin for excess zeal than to have problems for lack of care. Keep your diet healthy, especially when your appetite returns. I hope you enjoyed. Leave your comment below with your beautiful opinions. Thank you very much for watching until the end. Don't forget to like and subscribe.